So this ambulance coming in here is carrying a patient who they just announced coded en route. Everyone here is ready with their PPE because they just don't know what they're going to face. This is the front line in Canada's fight against COVID-19. This is an emergency room, a place where healthcare workers confront an invisible enemy and their own fears. A place we haven't seen till now. Good evening, I'm Adrienne Arsenault. Tonight, we will take you inside to meet the sick and those trying desperately to save them. A special report.
I'm Andrew Chang. Also tonight, the COVID crisis in seniors' homes.
I should have moved her. I should have really pushed to get her out of there.
Nearly half of Canada's deaths are in long-term care. Tonight, an elderly resident sounds the alarm from inside.
It's probably going to be a game changer.
A new COVID test with results in under an hour.
Stay the blazes home.
And the simple, blunt advice hitting home in Nova Scotia.
Stay the blazes home, stay the blazes home.
This is The National.
More wrenching signs today that older Canadians face the cruelest toll from this crisis.
One major reason seems to be a widespread failure to give seniors in long-term care a safe place to live.
We know that close to half of the deaths that we're tracking are linked to long-term care facilities. These deaths will continue to increase even as the epidemic growth rate slows down.
In Ontario alone, at least 89 homes are dealing with outbreaks, and more than 24 deaths were reported at a single residence just today. The Minister of Seniors emphasized that provinces should follow the federal guidelines to prevent and control COVID-19 at long-term care homes. They suggest staff wear a mask throughout their shift. They shouldn't be working in more than one facility. They should be assessed for symptoms at the start of every shift, and visits should be strictly limited. Now, when those measures aren't taken, the results can be disastrous for families, for staff, and foremost for the residents. David Common has the story of a terrified resident inside one of those homes where there's a desperate shortage of staff and care.
With care homes locked down, there are no outsiders to relay what's happening inside.
I've never, ever seen it like this. It's so bad.
At Toronto's West Park, one of many homes facing an outbreak, a longtime resident is sounding the alarm.
We're being neglected here, and I'm going to make sure everybody knows it.
We're disguising her voice because she fears retribution for speaking out.
I need help with washing up and getting dressed. I can't bend down. I'm not too bad. Compared to some others, it breaks my heart.
And she tells us between staff shortages and staff sicknesses, there's now just one nurse for 120 residents at night. Just one personal support worker to toilet, change, bathe, feed, do everything that's necessary for 20 high-needs residents. 5 residents have died here from COVID, one of hundreds of homes that's received emergency funding. But, says the resident, she hasn't seen any extra staff. In a statement, West Park, run by Extendicare, says staff are going to extraordinary lengths to provide quality care and taking measures to limit the virus's spread, but warns more deaths may occur before the pandemic is over.
I screamed for an hour and a half for help last night. Nobody came.
West Park has 200 residents, among them the mother of Ontario Premier Doug Ford's wife. She too is stuck outside, uncertain what's happening inside.
It breaks my heart watching Carla stand outside the window in tears, and there's hundreds of thousands of families in the same position.
And worried about transmission.
If you want this virus to spread like wildfire, you can't have one person washing and changing and dressing everybody here.
She fears the home and the system are close to collapse. David Common, CBC News, Toronto.
Now, this crisis for seniors has hit Quebec especially hard. Sarah Levitt shows us why there, the provincial government has had to step in.
With no news for days, family members do all they can to get word of their loved ones. Patricia DiBiase's 97-year-old mother lives with dementia here at Residence Heron. Despite the attempts to contact the home, she has no idea if her mom is sick or well cared for.
Does she have COVID? Does she not?
The home is at the center of a pandemic that has overwhelmed Quebec's long-term care facilities and the vulnerable population within. 31 people have died here in the last month, 5 with confirmed cases of COVID-19.
I should have moved her. I should have really pushed to get her out of there.
The province has pointed to at least 8 long-term care facilities with serious outbreaks. At this center, 30% of its residents have tested positive. 12 others have died. At another facility in LaSalle, 53 cases, 26 deaths.
What we're seeing now is the byproduct of several years of misguided reforms.
And the situation has exploded under the strain of COVID-19. Up until last week, the government continued to transfer patients into care homes to make room in hospitals. An already limited staff had more to do. Then they started getting sick.
The pressure right now must be unprecedented to be able to provide even basic care.
Premier François Legault admits the situation was flawed going into the pandemic. The province says it's sending inspectors to every single one of its thousands of long-term care facilities.
In the vast majority of CHSLDs and residences, people are cared for by dedicated staff.
It became a perfect storm for a body count, unfortunately, and the body count may not be over.
A concern validated today by Canada's chief public health officer. Sarah Levitt, CBC News, Montreal.
So now let's take a look at the situation across the country tonight. At least 833 people have died as the count approaches 26,000 cases, with the West still doing comparatively better than Central Canada. BC reported just 45 new cases over the past 2 days. Alberta, 81 today. Ontario, 421. And Quebec reported 711 cases. But as we've seen, numbers only tell part of the story. Briar Stewart takes a closer look at how Canada is faring overall in the battle to flatten the COVID-19 curve.
Perched along the edge of the water, Vancouver's Convention Centre is now equipped with 271 hospital beds. Not for COVID-19 patients, but those with other illnesses. But the site is empty because hospitals in Vancouver are still coping, as are others across Canada.
Things are pretty slow, and it's not unique to this hospital.
Dr. Michael Gardam is Chief of Staff at Toronto's Humber River Hospital. He says elective surgeries were cancelled to prepare for the expected onslaught of patients, so most hospitals have excess capacity. This chart shows the number of COVID-19 hospitalizations in the 3 hardest-hit provinces. Admissions are still going up, but only gradually, and some are optimistic they may soon decrease.
It's generally believed we're pretty much at or near our peak right now, and that in the coming week our cases will start to drop.
Some provinces, such as BC, are doing a better job at flattening the curve. And unlike in New York and some parts of Europe, Canadian hospitals haven't been overrun.
So in that respect, we're really doing quite well, but the numbers are continuing to go up in Central Canada in particular. And hopefully we'll continue to see a leveling off and a decline in the numbers in Western provinces.
Just because the situation isn't as bad as it could have been doesn't mean all the restrictions and physical distancing are going to go away anytime soon, a point officials continue to press.
My biggest fear is all of a sudden we get another wave and it hits us. I just want to make sure we do it properly.
I'm asking you as well to please keep on the line.
At some point, the decision to lift restrictions will be made, and when that happens, doctors warn it needs to be done carefully. Otherwise, the same fears around overwhelmed hospitals could emerge again. Briar Stewart, CBC News, Vancouver.
There is a new made-in-Canada device that will expand testing capacity across the country. Health Canada approved the portable DNA test, which promises some rapid results, and the first orders are already rolling out. Karen Pauls has a look at how it works.
Spartan Bioscience CEO Paul Lem demonstrates just how easy it is.
So you take a throat swab, you put the tip of the swab into this cartridge, you hit go, and then in about 30 minutes you get your COVID-19 test results.
The cube will light up if DNA of the virus is detected. Each device can do 10 to 15 tests a day.
It's credit to the government. We had a lot of R&D support over the years to actually develop this world expertise, hire our scientists and engineers, and now when Canada needs us, we're here to help.
Because of a shortage of testing materials and the people trained to do them, Canada has been doing targeted rather than widespread testing for COVID-19. Ontario has the lowest testing rate per capita. Premier Doug Ford hopes the Spartan tests will help change that.
Especially on the frontline healthcare workers and our first responders. We can get a result in an hour. Well, we might have to be, be testing people every second, third day.
The device is being targeted to airports, borders, and remote and rural communities. It's badly needed in the Northwest Territories, where it can take days to get results.
If the test has to travel from remote communities to Yellowknife and then down to Alberta, it really puts us behind.
It's probably going to be a game changer.
This rural Ontario physician says the rapid results will save lives.
The earlier we identify that there is a virus that's crept into a long-term care facility, the better we can then prevent it from spreading to others.
The Canadian government paid in advance on its order to help Spartan ramp up production.
We will get everything that this supplier will be able to provide in the coming months.
There is worldwide demand for this device, but Spartan says so far it's only selling it in Canada. Karen Pauls, CBC News, Winnipeg.
Now, along with testing going forward, we're also likely to hear more about tracking. That is, keeping track of where you've been and who you've been in contact with, all in order to help limit the spread of COVID-19. And as Thomas Daigle tells us, your own smartphone could play a big part.
Everywhere we go, every person we encounter, there's a good chance that smartphone is tracking us. The device stores data on places we've visited, information that could prove useful in flattening the curve.
That is an area of great interest to every jurisdiction. There are many, many innovators with lots of different ideas.
Take this app that logs a user's recent locations, warning them if they've crossed paths with a known virus carrier.
The more people that are in this, the better it's going to work. This is not some sort of tracking service, and there is literally no way for the government to live track anyone.
The technology has helped in Singapore and other Asian countries. Now Apple and Google are teaming up to allow for automatic contact tracing using smartphones elsewhere. And Britain is testing its own app for those who fall ill.
The app will then send an alert anonymously to other app users that you've been in significant contact with.
On my phone, in the app,
Canadian developers wonder when the technology will be approved for widespread use here.
there's going to have to be some clear guidance, especially to inform the makers of technology of how we can use these.
Canada is already reaching out to those potentially exposed, but it's the old-fashioned way, on the phone. The government hasn't ruled out using mobile device data, and that's quickly led to privacy concerns.
We have to subject it to great scrutiny. We have to ensure it's time limited with a clear deadline.
The technology's not perfect, but facing a global pandemic, every step could make a difference. Thomas Daigle, CBC News, Toronto.
So it's hard enough to get medical supplies when they're available. Now imagine those difficulties extending to everything. That is the situation facing Newfoundland and Labrador tonight. As David Cochran tells us, the main cargo transport company serving the province is threatening to shut down.
OceanX ships carry about half of all freight to the island of Newfoundland, including much of its food and medicine. But a pandemic-fueled plunge in other cargo like cars and trucks means the company is losing millions on these runs and may have to shut down.
We just can't continue. Basically, what's happened is it's costing us over $5 million a week to operate, and we're about $2 million short, so we can't continue to do that.
OceanX runs 3 ships a week into St. John's. It's canceling one. The other 2 need a federal subsidy to stay afloat.
It's getting progressively worse. It's not getting better. It's trending down still. Like this past week was worse than the previous weeks.
Oceanex deliveries fill the shelves here at the province's only Costco and other big box stores and grocery chains. An island with limited agriculture, Newfoundland relies heavily on Oceanex.
If you look at produce, you look at protein, meats, and so on, that we would have in our province. These things are not readily available unless they're brought into the province. So right now in Newfoundland and Labrador, you would have potentially up to about 5-day supply of food within the province.
Oceanex has asked Ottawa for a subsidy to cover its $2 million weekly loss. It shared financial data with the government this weekend.
I want to assure Newfoundlanders that we will find a solution to this.
The province's lone federal cabinet minister says Ottawa is still looking at it.
So we're looking at all the options right now. I mean, the most important thing is that the food supply chains that are in place, that Newfoundlanders rely upon, continue to stay in place.
Those supply chains are in place for now. The question is for how long? Oceanex is losing millions. It gets worse each week this pandemic goes on. And right now, there's no end in sight. David Cochran, CBC News, Ottawa.
British Columbia is trying to tackle one of the biggest COVID-19 outbreaks in a federal prison.
We are working very hard to ensure that the transmission within that facility will be contained.
The province says at least 35 cases have been confirmed at the Mission Institution, with 8 of those patients being hospitalized. That number could be higher, though, as the union representing correctional officers says a total of 6 officers and 41 inmates are affected. Nearly 6 million people have applied for emergency aid benefits in the past month. That includes both EI and Canada Emergency Response Benefit. The latter has seen 3.5 million people apply since being introduced just a week ago. The government says to date about 90% of claims have been processed.
I want to thank my good friend, Premier Jason Kenney, and the people of Alberta for this generous donation.
A show of gratitude today from Premier Doug Ford as Ontario is set to receive millions of masks, gloves, and dozens of ventilators from Alberta. This comes as the Ontario legislature prepares to sit tomorrow in order to extend the province's state of emergency by another 28 days. Ford says it's still too early to start lifting any restrictions.
In New York today, officials cautiously said the worst could be over, giving credit to frontline workers and public effort. Meanwhile, Donald Trump was giving credit to himself, defending his administration's overall response to the U.S. outbreak. Paul Hunter has more on tonight's unusual White House briefing.
From pretty much the get-go in this crisis, Donald Trump's taken heat for his response to it. Tonight, to reporters in the White House, Trump pushed back.
We have a few clips that we're just going to put up.
Showing video clips of state governors and others acknowledging steps that Trump's taken on this.
And I want to say thank you.
He returns calls. He reaches out.
The president has been outstanding through all this.
Rarely, if ever, has a U.S. president done such a thing in this forum. When it ended, Trump defended at length his actions on COVID and underlined why he tried to counter negative headlines with the video.
Why did you feel need to do that? Because we're getting fake news and I like to have it corrected.
Trump also clarified talk that he's upset with Anthony Fauci, lead scientist on Trump's coronavirus task force, about whom Trump had retweeted a post suggesting Fauci be fired.
Today I walk in, I hear I'm going to fire him. I'm not firing him. I think he's a wonderful guy.
Fauci himself took the podium, clarifying comments he made yesterday on how earlier steps on COVID would have saved lives. Misconstrued, he said, not meant to be critical of the president.
Where did that pushback come from?
No, it wasn't. That was the wrong choice of words.
All of this as U.S. deaths from COVID continue to mount. In Detroit, these images today of bodies in hospital side rooms because the morgue was full. And yet, as well, a glimmer of positive news.
We are stabilizing across the country right now in terms of the state of this outbreak.
And increasing talk, a number of states might soon reopen their economies, but with a caveat.
Do it carefully, do it slowly, and do it intelligently.
Tonight, Trump weighed in on that as well with a message to U.S. governors considering whether and when to reopen their economies. Said Trump tonight on that decision, it's he who has, as he put it, absolute power. Paul Hunter, CBC News, Washington.
Tonight, we have an exclusive look inside a Toronto hospital, a rare glimpse at what it is really like on the front line of Canada's fight against COVID-19. Does this make you nervous, this moment?
Yeah, it's a very stressful moment. I'd be lying if I said I wasn't nervous. No.
Up next, we follow a team of healthcare workers on shift as they confront and care for people who may have COVID-19.
We are doing everything that we can for the people that you love.
And later, doctors answer your questions about mental health, including, why am I having such a hard time sleeping? And a message from Nova Scotia's Premier strikes a chord.
Stay the Blazes home.
Stay the Blazes home. Stay the Blazes home.
We're back in 2.
The common good. Stay the Blazes home.
That, of course, the new evening ritual in many of Canada's neighborhoods, marking in places a shift change so healthcare workers can feel and hear the support. And in their selfies, they share their exhaustion with us. But we don't often see firsthand exactly what it is they're facing. So we went to have a look. Toronto's Humber River Hospital is one of the most advanced facilities for infectious diseases in North America, and yet the fear inside is palpable. They opened their doors to us so we could, through one shift at one hospital, better understand the cruelty of this global crisis. Some of what we captured on camera might be difficult to watch, but it shows you just a fraction of what healthcare workers are really up against and why they need all the support that can be mustered. The days of a simple good morning at the start of a shift are gone.
Had any cough or sore throat? No? Any traveling?
Absolutely not.
Nurses, therapists, ER physicians like Dr. Taslim Nimji work in an ever more threatening world.
Good morning, guys. Have a good day.
Personal protection equipment so precious now, it's counted like narcotics.
No, I need this one here. Need my autograph to get the N95?
Because nothing is kept out in the open, we have to get it from here. That way they sort of keep tabs on them.
But normally it would be kept out in the open, right?
Yes, that's correct.
But you just can't now because
No.
they disappear? Or?
We're running out of them, yeah.
She came with a shortness of breath, very COVID fever. So
we were invited to Humber River Hospital because of worries it's still not understood how callous COVID really is. It sounds like there's a fair amount of anxiety.
We love to help them in everything as soon as the patients arrive. Of course, safety of everybody is being compromised in here.
You sound a bit emotional, Nelson.
Yeah, it's because I don't know what will gonna happen to me, to us all every day, even.
Yeah, okay.
Because of this thing that's going on.
They don't have gear to spare, certainly not to give to visiting journalists. Okay, so we don't want to take anything. We are sometimes issued our own N95s for certain, hazardous shoots or whatever. Is it okay if I use this one?
Yeah, absolutely. It's okay for you to wear that here.
Okay, and goggles too?
Yep.
Okay.
Yeah.
But that's it?
And that's all you're going to need.
Okay. There are changes daily now, including installation of plexiglass barriers.
So we have a lot of nurses looking up charts and information on patients. We've put up plexiglass around this for some extra barrier protection. And, you never really know what's going to come through the door in an emerge on any day.
Within minutes, her point was made.
Our lowest. Yep, someone's coming in.
$9. An 88-year-old who's at home with a daughter.
Okay.
She's had a dry cough for about 3 weeks. And today she just wasn't feeling well. She said she was having some pain, discomfort across her chest.
Can I just clarify, is there been any fever?
Yes, 38.1.
Yeah, so fever, shortness of breath.
Hi, I'm Dr. Nimji. We're going to do like a check for COVID. Okay? You know the virus, the COVID virus?
With permission of Maria and her daughter, we kept watch.
I need to put this big thing in here into your nose all the way to your throat, okay? Okay. I know, it is not the greatest thing to do.
You just woke up in the middle of the night not feeling good?
Yeah.
Well, they did that test.
Oh, yeah. This hurts.
Yeah, I bet that hurts. For the moment, there's time for staff to offer extra tenderness. Curiously, fewer accidents or injuries seem to be happening now. The bays aren't full. COVID changes an ER and the instincts in it.
We're trained to get in there and do our thing quickly. And now that all goes out the window because we have to ensure that we're wearing the right amount of PPE in the right order before we go into those rooms. Otherwise, the entire team is at risk.
Everything takes longer now, and that hurts. They're about to find out how much.
Which entrance we're going in from?
The decon room.
Yes.
Anxiety levels are suddenly up. There's a patient on the way from a nursing home, and the cumbersome rationed gear has to come out. Does this make you nervous, this moment?
Yeah, it's a very stressful moment. I'd be lying if I said I wasn't nervous.
Who are the nurses going inside?
I'm going to EMS.
And who is the runner?
So this ambulance coming in here is carrying a patient who they just announced coded en route. So it's an 81-year-old, and everyone here is ready with their PPE because they just don't know what they're going to face. Look how hard it is to communicate. Because they don't know if this man is COVID positive, they have to presume he has it. Anything that goes in that room is considered compromised, so they're careful.
What was given?
Baby monitors and shouting from within the sealed room have to suffice. It's tense, it's wrenching, and we need to step back. Take a breath now, for those who can't. The hospital you're looking at was built after SARS, designed with that in mind. It's high-tech, filled with negative pressure rooms and meticulous attention to fresh air circulation. So it just doesn't seem fair that with the force of all that, the coronavirus is still in charge. And COVID-19 symptoms can really turn. They did for Frank. He and the staff allowed us to step in to talk. Mask and goggles, sufficient protection. So how long have you been feeling this bad?
Over a week now. But I've been getting worse lately.
He'd been coming for dialysis daily, but has no idea how he got sick.
Yeah, that's all I've been doing. I don't go shopping. I don't go out. I don't go nothing. They drop me off, and I go back home. That's it.
What does it feel like, Frank?
I'm really, really weak. Even if I try to stand up, I dizzy out, I fall.
Yeah.
Pain through my whole body. It's not a good experience. I'll tell you that much. I'll do anything for this to go away.
There's another wish, to not be so lonely.
That hurts the most because my family cannot be here. My son, my wife, anybody, my brothers, anybody. Nobody can come and visit. I don't think they can even bring me stuff.
He takes a moment to call his wife and lets us check in with her too. I just wanted to know, how are you managing with not being able to come in here and be with Frank?
Not too good. I've been crying a whole day and a whole night.
Yeah?
You're not getting any symptoms, are you?
No.
No, you mean my son, my brother?
No, Dad.
That's Mary Teddy in the room with Frank, a patient family liaison rep. Along with doctors and nurses, she's it for human connection for the sick now.
I think in regards to what I do, it's just how sad the patients are, because a lot of them, they don't understand what's going on and they're not sure why their families aren't coming to see them. So that's the hardest part.
Have you ever seen a hospital with no flowers, no balloons, no families? It's odd. The silences weigh heavily, especially in the ICU. This patient is on a ventilator, unconscious, struggling, and has only been in the hospital for a few days.
So this gentleman came in, and I would say within about, certainly under an hour, probably closer to half an hour after being here, needed to be intubated.
The brutality of the speed of that is not just medical. Again, it's about family. The ICU nurse is their lifeline. You spoke with his daughter every day and this morning?
Yes.
How hard is that for you?
It's difficult because there is no positive answer to give the family, but it's just support measures.
What do you think of this virus when you've seen what it does to these people?
It's very catastrophic. It's very, very sad to see how a patient deteriorates quick.
This gentleman spent the weekend in ICU. He's still there now. And back in the ER, Dr. Nimji's shift is close to ending, her stoicism close to cracking. The patient brought in earlier who coded did not survive. Everything possible was done for him, but she cannot shake what she could not do for his wife. So that looked hard.
Yeah, it is hard.
And you have to talk to the family.
That's the hardest part. That's the hardest part. The hardest part is when that family member, when that family member is weeping, and when that family member is begging you to do everything that you can, and when that family member can't be here. It's so important for us to let those people know, those family members that I've spoken to, and for anybody else who's been in that position, that we are doing everything that we can for the people that you love, and that it hurts us that you can't be here with them.
These are the refrains. They're scared and sad for those who cannot be with the people who matter now. And all that PPE muffles the sounds and the look of humanity, but doesn't erase it. Dr. Nimji's shift is long done, but Maria, the first patient of the day, is still here. And so she checks in.
Your heart rate is better.
And it's looking up. Maria's stabilizing hours after this, was able to head home. Dr. Nimji, too. To kids, she's too scared to hug for their sake. Do you have the stamina for the long haul?
That's a good question. You know what? Human beings are pretty remarkable creatures, and we are nothing if we're not hopeful. We'll have to get through to the other side. There is no choice, right? And when there's no choice, then yeah, there'll be stamina.
Scared, but determined. And as much respect as Canada already feels for people like these, they deserve more.
Adria, that is an incredible look at the work that goes on. And what's really surprising is how involved, how intense, how exhausting treating just a single COVID-19 patient can be.
You're right, just one. And the numbers, as we all know, are just part of the strain. Curiously, there are 31 COVID patients at Humber today. That's not a huge leap from last week, which might be a bit of a relief, but the anxiety there is certainly spiking because every one of the healthcare workers we spoke with was emotional, afraid, of course, but mostly worried about how to deal with patients both deteriorating really fast and then going through the worst moments of their lives without family. That is a huge responsibility for healthcare workers, and it's just one more element to COVID that is just so traumatic.
Yeah, indeed. All right, next on The National.
I feel like we're in a science fiction movie, and I am one of the ones walking around with an immunity, almost like a hazmat suit, inside my body, protecting me.
Why researchers hope she and other survivors could be a weapon in the fight against COVID-19. And later, the doctors answer your mental health questions, including this one about having a hard time just getting out of bed in the morning. Any advice? There absolutely is, just ahead. COVID survivors are making their own contribution to make sure others live. They're giving blood to study the protective powers of their antibodies. Susan Ormiston introduces us to the Survivor Corps.
Day one out of quarantine, and Julie Thaler, with her Survivor cape, is headed to donate blood filled with powerful antibodies.
I feel like we're in a science fiction movie, and I am one of the ones walking around with an immunity, almost like a hazmat suit, inside my body, protecting me, and now I have a chance to help other people get that same protection.
Look at it go. Look at it go.
Diana Barrett was also one of the first donors, part of clinical trials to see if convalescent plasma can build immunity in frontline workers or help those critically ill.
This is it. You're looking at my plasma.
For 18 days, she fought back.
But I'm scared.
On better days, she hatched a plan for Survivor Corps. In 3 weeks, 30,000 members.
You're home and you're scared, knowing that there's, at the end of this, that you could save lives is a tremendously motivating factor. I can't even tell you, I felt like a superhero the other day.
There are now multiple studies being fast-tracked in the United States looking at those antibodies. What can they tell us about immunity to COVID? How long can it last? Can it help those already suffering? And will this group be the first cadre of volunteers or people able to reemerge in the workforce? But research is complicated. Plasma antibodies come in different types.
It may be that certain antibodies are beneficial and certain antibodies are harmful. And so we need to figure that out too.
Dr. Eldad Hode is building up a plasma bank for trials.
We don't want to just roll this out for everyone as compassionate use before we find out whether it could be harmful in certain situations.
Andrew Sherman's whole family got COVID. He was hospitalized. Now he wants to be part of that protective army.
I'm not the only one. You know, there's a growing number of people that are coming through it. If I can help, I'm going to help, you know.
Survivors hold a key to the healing. Susan Ormiston, CBC News, New York.
Okay, in just a few moments on the other side of the break, we're going to have our panel of doctors joining us to talk about not just your health, but your mental health. Your questions coming to us about everything from your morning routine to the amount of sleep you get to this question. I feel really alone at a time where I need emotional support. How can I get it? Don't go anywhere. Hey, welcome back. Time to answer your COVID-19 questions. Tonight, though, our focus is on mental health because for many Canadians, the pandemic has unpacked a real struggle with loneliness, anxiety, depression, and honestly, just trying to get enough sleep. So joining me tonight, we have Dr. Gans Ference, goes by Dr. Gans, a psychologist in Edmonton, and Dr. David Greatzer, a psychiatrist at Toronto's Centre for Addiction and Mental Health. Hello to the two of you. We're going to get started because we've got more than a few questions to get through. Dr. Greatzer, let's go to you first. I'm finding it hard to get out of bed in the morning to start my day. Any advice?
Well, that's not entirely surprising. Many of us are in a very different routine than we usually would be because we're not working or perhaps we're working from home. And maybe the best advice here is just trying to stick to a little bit of a schedule. Set the alarm, get up out of bed, try and have some sort of a routine, whether that involves work or other activities, and try and stick to it.
Right. Dr. Gans, take the second one for us if you could. I've heard this one an awful lot. Why am I having such a hard time sleeping?
I would say the same thing. I mean, really, we're out of routine. We don't have the same sort of drive or external structure that we normally have to get up and get moving. So the external routine that we establish ourselves is going to really help us. And then also, if you are having a hard time sleeping, set a steady wake time and just kind of stay with that. And after a while, your body will catch up. And then that will get you back into your own routine. You'll sleep a lot better.
And when it comes to that routine, I mean, Dr. Gans, do you go the whole 9 yards, not just in terms of the time that you wake up, but I mean, getting dressed as if you're going to work and trying to do every little thing that you would normally do?
I would actually, you know, whatever we can establish ourselves to get into that normalcy of life is going to help us. It's going to help us to get into that rhythm, but also going to give us back that sense of control that a lot of us are missing right now because there's so much uncertainty. We really need to have that as a legitimate need to have a sense of control over our own lives. So this will really help.
Okay, Dr. Greatzer, I saw you nodding your head there, but let me throw another question at you, and this is a tough one. I'm grieving the loss of my husband, and I'm alone for the first time in 45 years. I feel really alone at a time where I need emotional support. How can I get it?
First things first, I'm very sorry to hear about your loss. What an incredible loss and an incredible time. I think reaching out to friends and family, whether that's by phone or by Skype or other means, would be really useful. Also be aware that a lot of self-help support, a lot of support groups are actually still available. So as an example.
Yeah, go ahead.
Bereaved Families of Toronto, which is a wonderful not-for-profit organization, is not meeting with people in person, but they're still providing a lot of counseling over the phone and over the internet, and there's sister organizations like that all across the country.
And I know a lot of folks have had trouble wrapping their minds around video conferencing. Either it feels overwhelming or they're just not used to the technology. What do you advise on that front?
Try it. It's surprisingly straightforward. As a provider, I listen to doctors and psychologists all across the country explain to me it's not the same online, et cetera, and then they try it and they explain, actually, that was pretty good. So I think the technology is a lot more sophisticated than a decade ago. There's still some nuances, a lot of great resources available online if you're a provider trying to get into this, or a patient trying to understand how you can have a therapy session online. But yes, the technology is there and accessible.
Well, lots more questions I could ask you, but this is just a start of a conversation, I'm sure. Dr. Gans, Dr. Greatzer, thanks so much for your time.
Thanks for having me.
Now, tomorrow night, this segment will focus on your finances. So whether you're a business owner, an employee, or you're navigating your rent or your mortgage payment, there's a lot of uncertainty right now. So send in your questions on Instagram at CBC The National, or you can send us an email at thenational@cbc.ca.
Next on The National, a blunt message from the Premier of Nova Scotia takes on a life of its own.
Stay the blazes home.
What did the Premier say to do?
Stay the Blazes home! Stay the Blazes home, the appeal that's become a rallying cry during a pandemic. We're back after this.
I'm Jamie Poisseau, and tomorrow on CBC's Daily News podcast Front Burner, internal documents show Canada was 2 steps behind as the pandemic gathered steam and crashed into this country. Subscribe wherever you get your podcasts.
Welcome back. We've heard it over and over again from politicians and public health officials the world over. The best way to beat the coronavirus is for people to stay home. But one comment from the Premier of Nova Scotia has become more than a plea for compliance. It has become a provincial motto. Tom Murphy explains.
It means staying home.
Please keep up your physical distance.
And stay home as much as possible.
The message? Well, it's for everyone's own good, if not a tad repetitive. But in Nova Scotia, just as people might have been lulled into complacency, came this little gem from Premier Stephen McNeil.
When all we have to do is stay the blazes home.
It sounded kind of cross, but look at what is normally Halifax's busiest downtown street. Hardly a soul. That scolding might just be getting through to people.
What did the Premier say to do?
Stay the Blazes home!
Stay the blazes home.
And then, amid all this isolation, you guessed it.
Stay the blazes home, stay the blazes home. Think about the common good, stay the blazes home.
The songwriters took over. In this case, the Stanfield.
If you got the inkling, you wanna go to town. Remember there's a nasty bug going around.
And they weren't the only ones. Merchandise started popping up, t-shirts and the like, with profits going to the food bank.
Stevie boy, stay the blazes home.
But more than just a lark, as this pandemic grinds on and the messaging becomes more critical, this kind of thing can actually be good.
You got to find a way to break through that 20 to 30,000 messages of clutter we get each day.
Business professor Ed McHugh told us, from his home of course, that the Premier was able to punch through.
I watched and I immediately went, he's got it. I said, that was it. It clicked for me, and it clicked for a lot of people. You got to find something that stands out, and it's even what works best is slightly tongue-in-cheek. That works better than the straight scientific information that we get, right now every single day.
If you got the hankering to go and get your fix, to party with your buddies and drink a beer or 6.
Now, in Nova Scotia, there are no kitchen parties allowed at this time, social distancing and all. But there's a beer, further evidence that this catchphrase is really catching on.
It's okay to find the humor in these words. After all, we could all use a bit of humor now. But it's very important that people understand and heed the message behind the words.
A potentially effective message that may help ward off the virus, and a little creativity to deal with that cabin fever. Tom Murphy, CBC News, Halifax.
Next on The National, with concert tours canceled across the country, Glass Tiger's oldest fan was serenaded another way. Our moment is next.
Back in August, the lead singer of the 80s rock band Glass Tiger surprised a superfan at her retirement home in Edmonton. It kicked off a friendship between Alan Frew and 96-year-old Gene Savage. She was planning to see him on tour in March, but with concerts canceled, Frew found another way to perform for her, and that is our moment.
And I thought, here's a great idea. If I can get old Gene on at the nursing home, I can serenade her. And so I did. I sang to her over Instagram.
Go for it, Alan.
Fairy tales can come true. It can happen to you if you're young at heart. And so here's Gene at 96 But you got to know that in her heart and in her mind, she's 26. When I sing to her, I see it in her eyes.
For it's hard you will find to be narrow of mind if you're young at heart.
Sorry, that makes me so happy. So Alan had a whole plan for that concert. He was going to pick her up in a limo. He was going to send her, bring her to the gig. He was going to come down from the stage. He was going to sing to her. He had it all planned out, but I just looking at her face, I feel like this is maybe just as special.
Yeah, well, and of course all of his, lousy that all of his gigs have been canceled, but he is apparently every day at 4 o'clock, he's doing live gigs on Instagram, and Jean just keeps watching them over and over again. That's The National.
Go
this
Jean, go.
April 13th. Yeah, good night.